Good morning, everyone. The COVID-19 outbreak last winter at the Extendicare Parkside Special Care Home resulted in many deaths. And that's why our government asked the provincial ombudsman to investigate the circumstances that led to this terrible tragedy, to determine what went wrong, and to make recommendations to ensure that this never happens again. I want to thank the ombudsman for taking on this difficult task and for her report, which was released today. Today's report is very troubling, and we need to do better. The findings and recommendations in this report provide a clear path to do better. The Ombudsman concluded that Parkside failed to protect its residents in a number of different ways. They were, quote, lax in enforcing the public health orders and implementing effective infection prevention and control measures, and were, quote, woefully unprepared for the outbreak, despite all of the support offered and provided to it by the SHA, end quote. She also concluded that, quote, the SHA generally gave Parkside reasonable support during the pandemic and outbreak. However, there were some areas where effective oversight was lacking, end quote. And for that, on behalf of the government and the SHA, I want to apologize to the families and friends of all of those who died in Parkside as a result of COVID-19. The government and SHA has accepted all of the Ombudsman's recommendations to ensure this can never happen again. And we fully expect and intend to ensure that Extendicare and Parkside accept and implement all of the recommendations directed at them. In order to ensure that this happens, the SHA has been appointed administrator over all 5 Extendicare long-term care facilities in Saskatchewan for a period of 30 days. At the end of 30 days, the SHA will submit a report to the Ministry of Health regarding compliance with the Ombudsman's recommendations and the care requirements as stipulated under the program guidelines for special care homes. At that time, the SHA will reevaluate its ongoing relationship with Extendicare and Parkside and whether it should continue. The Saskatchewan Health Authority has assured me that they recognize the seriousness of these events and are taking action as a result. The SHA has advised that regarding the recommendations, they have fully implemented the directive requiring no more than 2 residents per room within all long-term care homes in the province. And work to update the Principals and Services Agreement has already been in progress for many months. And with the full support of the Ministry of Health, the SHA will work with affiliated and contracted long-term care providers to include the applicable Ombudsman's recommendations in an updated Principals and Services Agreement. The SHA has also committed to continue work to implement those recommendations to improve quality and safety in our long-term care homes for those in our care. I would take any questions that you may have this morning. Thank you.
What does it mean for the SHA to be the administrator? Will they take full responsibility for the operation of those homes during that period, and why only 30 days?
So the reason we've decided to have an administrator appointed is because the Ombudsman's recommendations identified some specific challenges, particularly with this home. But we do note that in the Ombudsman's report there are some concerns highlighted with respect to some of the comments and decisions made by Extendicare Regional Management. The point of hiring or appointing the administrator is to have someone there that ensures that the recommendations from the Ombudsman directed at Extendicare are followed up on and accepted, and that action is taken.
As I understand it from the report, the SHA had beds available elsewhere in the system during the pandemic, as we know, because you were able to move people from the entire village. Why was no effort made to reduce the population of crowded homes like Parkside before the outbreak occurred, especially when Extendicare was warning you that they weren't able to follow public health guidelines because of the crowding?
There were, there were a number of conversations, it's my understanding, between the SHA and Extendicare throughout the pandemic, right from the beginning on a number of items. One of the recommendations today, as I've talked about, is from the Ombudsman indicating that we need to end the practice of 4 residents per room. That practice actually ended as of March 31st. There are no homes in Saskatchewan that have that have 3 or 4 residents per room. I think what's most concerning is that there were many opportunities across the long-term care sector in this province to try to mitigate the effects of COVID-19, whether it was reducing the number of residents per room, the masking and cohorting requirements of staff, all of the things that not just in long-term care, but businesses had to undertake in order to limit the spread of COVID-19. We had there were outbreaks in other facilities in this province, in SHA-run facilities and in affiliate-run facilities and in private facilities. But none to the extent of what happened at Extendicare and the Parkside home here in Regina. So there were multiple opportunities, I think, for and multiple steps that could have been taken to help prevent the spread and limit and manage the spread of COVID-19 when it did get into a long-term care facility, and that was one of several factors.
But it says here that as early as March 2020, health authority officials were aware that there could be a serious risk of a serious outbreak because of the 4 bedrooms. Mm-hmm. So why at that time, when you knew there was a risk, months before the event happened, did the SHA and the ministry not ensure that those 4 bedrooms were turned into 2 bedrooms and moved those people to other facilities?
Again, there were numerous conversations between the SHA and Extendicare about reducing the number of patients per rooms, and I think the Ombudsman references that in her report and some of those conversations and the nature of those conversations.
Why just conversations? Why not action?
Well, again, there was an opportunity for that to happen, but in addition to that, there was opportunities. We were trying to manage this across the province, not just, and there were guidelines and policies in place for all of our healthcare facilities. That includes hospitals and long-term care homes, group homes, schools, everything across this province, to try to mitigate the spread of COVID-19 as best we could. Dealing with the information that we had at the time, what we had at our disposal in terms of being able to limit the spread. Again, the Ombudsman has made a recommendation with respect to that. We followed through on that recommendation and have taken that step as of at the end of March.
Just one more from me, and then I'll
Sure.
It seems as though Extendicare has been calling for about a decade for funding to update that aging home. Why has it taken so long to come to an agreement about that? And are you now ready to commit funds to update those homes as soon as possible? Or should that be on Extendicare?
So, well, it's an excellent question, and I would point to this. We as a government have been trying to. We've got a number of facilities in this province that need to be replaced. We have replaced, just on the long-term care side, we've replaced 15 long-term care facilities in Saskatchewan since 2007. There's other projects currently underway in multiple communities across this province, and some new projects that were announced just in this most recent budget. And I'm speaking specifically to the communities of Estevan and Watson. And as recently as this was announced in the budget, but as recently as last week, we provided more details on the replacement of long-term care beds here in the city of Regina. A 600-bed replacement project, of which 250 will be specialized beds, and the remaining 350 will be the standard beds that we have yet to determine how those will be deployed. So we recognize that we need to be able to do this, but we try to do it as quickly as we can, recognizing that there's pressures across the province, not just in Regina, not just in our major centers, in our rural locations as well, in northern Saskatchewan, frankly, as well, where, as an example, we're going through the process of replacing a long-term care home in LaRange. But it's, we're trying to get to these as many as we can, and frankly, every one of those facilities that has been built has been to newer, updated standards where they do not have 3 and 4 residents per room, provide a more home-like setting, and it's something we're trying to get to as quickly as we can as a government.
I just want to build on that. So, this has been a quite a long lobbying effort. On one hand, Extendicare is a private company. It's publicly traded. That's posted profits for many years, and it's contracted by the government to run this place. So you have both the government and the company flagging these issues. Who should take responsibility in paying for this updated facility? Do you think it should be the ministry, or do you think the obligation is on this private company?
Well, we have, we have a mix of different types of facilities in this province. The vast majority are run by the SHA, by the government. We also have a number of affiliate facilities run in this province as well. And then 5 private for-profit facilities, all run by Extendicare, 3 in Regina, 1 in Saskatchewan, 1 in Moose Jaw. We are trying as best we can with the resources we have to update, repair, and replace facilities where we need to as quickly as we can in this province. Recognizing, as I said earlier, that we have needs across Saskatchewan, and there's expectations from people across Saskatchewan as to what's required for their loved ones. Again, we're trying to do that as best we can, knowing that we do have a mix of different types of operations for long-term care homes in Saskatchewan, and we're going to do that as quickly and efficiently as we can.
So kind of cost sharing then between the two of you, or cost by the ministry?
We haven't made any decisions on that. Again, we've outside of this, we have Regina Pioneer Village, which we have known for a number of years is in need of replacement. We've got some issues there. There had been some work done the last 2-3 years on the replacement of that particular facility, and in this year's budget, we decided to expand the scope of that project. Again, SHA-run facility, and then again, as I said last week, we provided a bit more details on what the scope of that project would be in terms of the number of beds. Still a lot of decisions to be made on that particular project, location, where will all the beds be located, but I would just speak to, we have some decisions to be made yet in terms of long-term care going into the future.
I just have 2 others. I'm just going to stand.
Sure, yeah.
It'll be a bit better. So you're going to be administrating Extendicare for 30 days and then reevaluating your ongoing relationship. What does reevaluating mean?
Well, today what's happened is the Ombudsman has provided a very thorough and detailed report, and I thank her for her work and the work of her office going to this extent in providing the recommendations that she did. The SHA and the government has immediately accepted those recommendations. We've already implemented the first one in reducing the number of residents per room. We're well on our way on the other recommendations there that were as part of the Ombudsman's report and recommendations today. We just think that we need to make sure that we follow through on those as quickly as we can. But the other important factor is that Extendicare does. There were 4 recommendations here specifically geared towards Extendicare, and I would hope that they would accept those recommendations and that they would implement them quickly.
So then reevaluating is reevaluating, making sure that they're doing their part?
Yes, yeah, and then and reevaluating the nature of our involvement with them into the future.
And lastly from me, the report talks about how employees were still going to work when they were symptomatic. An employee was told to get a test and they didn't and continued to work. Now, part of the report talks about how the ministry doesn't play a direct role in enforcing the public health measures in the long-term care homes. So given what has been found with employees and not following these regulations, is your ministry and the SHA maybe going to fix this arm's length approach and be a bit more hands-on with special care homes given what's happened?
What the Ombudsman found in her investigation and which led to the recommendations today, frankly, some of it is quite troubling, quite concerning, and on behalf of the residents who died, saddening. It never should have happened. It shouldn't have happened in this home or in any other long-term care facility in this province. The recommendations from the Ombudsman today need to be implemented by all parties to make sure that this never happens again. It's disappointing. I would have expected that they would have accepted the recommendations and apologized. And I guess in seeing that that statement from Extendicare speaks to why we've also appointed an administrator here for the next 30 days.
I imagine you've had some communication with Extendicare through this process. And I guess how much communication has there been between Saskatchewan government and Extendicare, and through that communication, are you satisfied with the level of responsibility that Extendicare is taking for this outbreak?
Yeah, I understand that there has been communication between officials, with the government and the SHA, with Extendicare throughout this process. As I said earlier, we had, and not just in this province, but there were outbreaks across this country in long-term care facilities, and we saw the devastating impacts that could have in places like Ontario and Quebec. And I think we all tried our best to make sure that we were protecting, particularly in long-term care homes, where we have some of the most vulnerable people, vulnerable to COVID-19, that we provide, make sure that they're protected and that they are safe. It's disappointing in reading the Ombudsman's report today, and concerning that there were a number of things that happened throughout the pandemic, and of course leading up to the actual outbreak at Parkside, that probably could have been prevented. Again, we saw outbreaks, and COVID did get into other long-term care homes in this province, no doubt about it. Got into SHA facilities, got into affiliate facilities, got into the Extendicare facilities, but none had the impact that they did at the Parkside location.
And when you say you reevaluate the nature of the relationship with Extendicare, is termination of that contract with Extendicare a possibility?
We're looking at all of our options.
I just want to build on a previous question. There were no recommendations specifically made for the Ministry of Health because from the reports, I believe she pointed out, you guys didn't have any great involvement in this. And I believe at one part, if I'm not wrong, there was some talk about employees of the ministry not knowing that there was anything wrong at the home until the co-management agreement was entered into. So looking back on that now, is that arm's length approach, why was that done, and was that the right approach, or should there have been something different done on the part of the ministry?
Yeah, we'll be, as I said, we'll be reevaluating, as a result of the Ombudsman's report today and her recommendations, and just some of the, the detailed specifics that she found in this specific case. We'll be reevaluating, what we need to do to improve this going forward. How do we make sure that we improve the healthcare system, and for seniors in this province, how do we make improvements to ensure that this never happens again in Saskatchewan? That we don't have a situation like this where dozens and dozens of people lose their lives. Government's committed to strengthening the oversight and the quality and performance that we have, the standards in place to make sure that this doesn't happen again. Something that will be happening this fall is, and this actually has been underway for a number of months now, and it kind of predates COVID and the outbreak. But we, through the Ministry of Health, will be introducing a new compliance review and inspection reporting process this fall for long-term care facilities. So that will begin a little bit later this year, with full implementation of that starting in the new year as well. Again, that's something that's been underway for a while in terms of the development, but that's an example of somewhere or of an area where we're going to be increasing what we do to ensure that we're protecting those that are in our care homes.
Given the fact that we knew from other provinces that this was a problem in care homes, there could be a lot of deaths, there could be a lot of cases, shouldn't the ministry have been taking a more involved approach when it came to long-term care homes at that time?
So the ministry works through the SHA, which then of course worked with Extendicare to make sure that the rules are being followed and the guidelines are being followed, and everything in terms of the public health order was being followed. The Ombudsman's report today, and I've read through it, details a number of instances where the SHA spoke to Extendicare about what needed to be done to bring them up to compliance in terms of the public health orders to manage COVID-19, and that didn't occur. And I don't know why that didn't occur. should have happened. You know, we did not have these sorts of challenges, to my knowledge, in any of our other facilities, any of our other SHA-run facilities, or any of our affiliate facilities. But we had some specific challenges with Parkside in Regina.
And when it comes to, just so I'm clear and I
Yeah.
understand what you're saying, when it comes to replacing the facility and, Extendicare having wanted a new one for the past 10 years to fix a lot of the problems that, according to this report, contributed to the outbreak, you're saying that it's like it just was on the list and it hadn't gotten around to by now? Or?
No, they're a private company. They own facilities across the country, and we also have our own facilities that the government owns and operates here in Saskatchewan. And we, on an annual basis, through budgeting and through our systems, try to determine and how do we feasibly get around the province to make sure we replace and repair long-term care facilities, hospitals, whatever it might be within the health system that are under our purview. So I know that there's been conversations for a number of years between Extendicare and the ministry on this particular facility, but as I said, we have facilities such as Regina Pioneer Village that we own and operate, and also in desperate need of replacement and repair there as well. So we're trying to get to as many of the replacement projects on our list on government-run facilities as quickly as we can.
So I guess from that, I'm hearing that replacing this facility, you feel it's not the government's responsibility.
Well, I would say this. We, as I said, we operate our long-term care system through a number of different partners. The SHA and the government-run facilities make up the bulk of the facilities, the long-term care homes in Saskatchewan. There's also a significant number of affiliate care homes, not to the same extent as SHA-run facilities. And then we have the 5 private facilities, all operated by Extendicare, but they operate a bit differently in that they're a private national company that has facilities across the country. So I think there's also some responsibility on them.
In terms of responsibility, you did apologize on behalf of the government. Do you feel like there was a failing of political leadership on the long-term care file?
No, Arthur, I think this never should have happened, regardless of, what type of facility it was in. And, we saw what could happen based on, instances or incidents in other provinces, frankly, in other countries too. Just the devastating impacts that COVID-19 could have if it got into a facility, particularly a seniors home, and wasn't properly managed. And I think we all knew and recognized that I don't think it was a matter of if COVID-19 would get into our facilities, but when. And when it did, how do we manage it? But also, how do we prevent it from getting there as long as we could? But once, if COVID did get into a facility, how would we manage that? And not just in our facilities, the affiliate facilities, the private-run facilities, as I said, even outside of the purview of healthcare in other parts of our province. And I just think, again, this shouldn't have happened. 39 people lost their lives.
There's one thing that I really don't get, and that's the fact that the continuous masking policy wasn't followed even during the outbreak up until December. And the Ombudsman found that even SHA officials didn't appear to be aware that that was required. I just don't understand how that could happen.
Yeah.
I mean, that was a public health order
Yeah.
that was publicly available. Do you have any explanation for that?
I don't. No. This was an expectation of everybody in the province to understand what the rules were. That would be a question for the SHA. All right.
Thanks, everyone.
Thank you.